Good day everyone. Today we look at the vital pillar of Malaysian healthcare, which is the Malaysian National Policy or DUNAS, endorsed by the Cabinet in 2006. These policies serve as the official roadmap guiding the nation pharmaceutical sector. Its primary mission is simple yet powerful. It is to ensure that all medicines in Malaysia are safe, effective, affordable, and accessible to every citizen. Furthermore, it emphasizes the rational use of medicines to directly elevate public health and well-being. To achieve this, DUNAS provides a strict framework to regulate pharmaceutical services. It bridges the gap between public and private sectors, focusing heavily on strong governance, quality, medicine use, and strategic industry partnership. Ultimately, Malaysia aims to reinforce its healthcare system by ensuring continuous access to quality treatments and promoting sustainable pharmaceutical practices. DUNAS protects the health of our nations. Now, let's look closely at the core objective of this policy, which are divided into two critical pillars. The first pillar is access and standard. This objective is dedicated to ensuring equitable access, meaning that safe, high quality, and affordable essential medicines are continuously available to every single Malaysian, regardless of where they are. To support this, we focus heavily on global compliance. This means aligning our own domestic regulation with strict international agreements and WHO benchmarks. Furthermore, we are committed to upholding market integrity by strengthening enforcement frameworks like DIDIC to effectively curb the illicit sales of unregistered medicines online. Our second major pillar centers on usage and sustainability. Here, the policy drives rational usage by promoting generic prescribing and implementing highly transparent medicines price settings mechanism. Ultimately, it all comes down to strategic resiliency. By successfully balancing economic sustainability with social equity, Malaysia can secure a dependable, robust, and highly resilient pharmaceutical sector for the future. Thank you.
Assalamualaikum and good day everyone. Today I will present the importance of MNMP. Firstly, MNMP promotes public trust. By establishing a clear regulatory framework, the government ensures that healthcare operations are carried out ethically and transparently. This allows the public to feel more confident that medicines provided are safe, effective, and properly managed. Secondly, MNP standardized regulatory frameworks. With standardized regulations and procedures, the government can improve efficiency in evaluating and approving medicines. As a result, access to life-saving medicines can be accelerated while still maintaining safety and quality standards. Lastly, MNP optimizes public resource management. This policy helps ensure that public funding is used efficiently and not wasted. Through proper planning and monitoring, resources can be allocated effectively to improve healthcare services and provide better access to medicines for the community. That's all from me. Thank you.
Next, I'll discuss the key issues and challenges of the Malaysian National Medicines Policy or MNMP. First, the misuse of medicines remains a major concern, including self-medication and improper use of prescription drugs. Second, the presence of counterfeit or unsafe medicines. And third, public awareness on the rational use of medicines still limited. Therefore, continuous education are essential to address these challenges to ensure success of MNMP. So, I will explain more in the next slide. Now I will discuss two major challenges addressed by the MNMP, which are the misuse of medicines and the counterfeit or unsafe medicines. First, medication abuse and misuse affect people all ages and a cure in both developing and developed countries. The main causes include easy access to prescription medicines and lack of public awareness regarding their proper use. As a result, misuse can lead to serious health consequences such as organ damage, overdose, burden on healthcare facilities, and emergency service. Second, counterfeit and unsafe medicines have become a significant global and local threat. According to the World Health Organization, around 10% of medicines worldwide are substandard. In Malaysia, these products are commonly distributed through illegal markets. Counterfeit medicines may contain incorrect ingredients. Therefore, stronger regulation and enforcement are essential to ensure safe and effective use of Malaysian medicines. This slide highlights public awareness on the rational use of medicines. First, educational campaign in the school and university helps students understand medicine labels, proper antibiotic use, and safe medications conducted by the pharmacist. Second, communities are empowered through local leaders who receive training and act as health ambassadors. Finally, collaboration between Ministry of Health, media agencies, and local councils help preventing false claims and protecting consumers from misinformation. Together, these efforts encourage the safe and responsible use of medicines in the society. Thank you.
The main objective of the MNMP is to improve the overall health and well-being of the Malaysian population. One of the biggest impacts of the MNMP on Malaysian society is that it helps ensure the safety and quality of medicines available in the market. Before any medicine can be sold or used by the public, it must go through strict evaluations and approval process conducted by the National Pharmaceutical Regulatory Agency (NPRA). This process ensures that every medicine meets high standards of quality and safe. As a result, Malaysians are protected from harmful, fake or low-quality medical products. The public can feel more confident knowing that the medicines they purchase from pharmacies or hospitals have been carefully tested and approved by the government before reaching consumers. In addition, the MNMP plays an important role in safeguarding patient health and improving hospital safety. The policy introduced systems and guidelines that reduce the risk of medication errors and drug-related problems during treatment. One example is to ensure medication safety, which is used to assess healthcare facilities on how they safely store the medicines. This initiative helps healthcare professionals follow proper procedures when handling medications. For instance, it reduces common but dangerous mistakes such as giving the wrong dosage that may cause allergic reactions. Consequently, hospitals and healthcare facilities become safer environment which increase public trust when receiving medical treatment. Furthermore, the MNMP also improved the affordability of healthcare for Malaysians. The government understands that some modern treatments and medicines can be very expensive, especially for lower and middle income families. Therefore, the policy supports programs such as the Patient Access Scheme (PASC), where the government collaborates with pharmaceutical companies to reduce the prices of costly medications. Through this financial arrangement, more patients are able to receive treatments that will otherwise be beyond their financial ability. Thank you.
Good day. This presentation outlines strategic recommendation designed to enhance the Malaysian national medicines policy as the pharmaceutical landscape grows increasingly complex. Evolving regulatory and public health approaches becomes essential to protect the population. The proposed framework is built upon three interconnected pillars, as detailed on this summary slide. The first pillar focuses on strengthening enforcement and monitoring, given the rising global threat of substandard and falsified medical products. Solidifying local regulatory framework is vital to maintain an uncompromised line of defense against dangerous or unregistered pharmaceuticals. entering the market. The second pillar centers on enhancing public education and awareness. Comprehensive consumer protection cannot rely on top-down regulation alone. Empowering citizens and healthcare professionals with the objective knowledge required to identify risks, evaluate health claims, and actively participate in regulatory oversight remains critical. Finally, the third pillar addresses improving collaboration between agencies. Managing this expansive landscape in isolation is inefficient for any single governmental body. Active efforts must be directed towards breaking down institutional silos and building synergistic partnership to streamline nationwide operations. The subsequent slide details the specific actionable steps proposed for each of these three critical areas. Implementation of the first pillar involved robust post-marketing surveillance and routine supply chain inspection. Public participation is facilitated through the Pharmacy Services Program portal for rapid registration, verification and reporting. Regarding education and awareness, the Ministry of Health should launch annual collaborative project and conduct 8 training of trainer sessions to equip 140 educators yearly. Furthermore, a 100% evaluation rate for therapeutic claims will be enforced to eliminate misleading labels. Finally, interagency collaboration is strengthened by formally recognizing 6 private laboratories to expedite testing workloads. Additionally, synchronization between the Pharmacy Enforcement Division and municipal councils such as DBKL or MBJB enable the immediate removal of illegal advertisement and the issuance of fines. This synchronized effort collectively ensures a safe, high quality healthcare framework for the Malaysian public.
To conclude, the Malaysian National Medicines Policy ensures equitable access, effective and affordable medicines for all Malaysians. It strengthens healthcare services and pharmaceutical sector through effective regulations. Additionally, the policy promotes the rational use of medicines, improving patients' outcome. Continuous commitment from all stakeholders is essential to sustain its benefit to the future generations. Thank you very much.